screws up and loss of colour and so on, vision.
So the question is, fingolimod and Tysabri, are they helpful when your relapse presents with visual change, where the world screws up? Yeah. So the interesting thing about these medications, based on how they work, so they block the immune system getting to your brain, or they hold the immune system in the lymph nodes, is that they won't actually help with the relapse that you're having at the time that you're presenting to your neurologist. So the only thing that we have in 2015 for an actual relapse is steroids, or very occasionally we filter the blood and take the proteins out of the blood, so that's plasma exchange. So acute treatments of a relapse are very different from disease-modifying drugs or preventative therapies, which is what fingolimod or Tysabri are. So at the time of your relapse, the question is, should this person have steroids or plasma exchange? But then the next question should be, are they eligible for treatment? So the upfront question, thank you for asking. Yeah, so thank you for asking that question, Colleen. So we haven't talked about treatment of relapse at all today, but so the treatment of an acute event is steroids or plasma exchange. Then you go on to disease-modifying therapy that hopefully means that you don't have another relapse. There is evidence that if you're on those treatments and still do have a relapse, that it's likely to be way less severe than it would have been if you weren't. The other thing that's really, I think, quite helpful for patients to know is that because of the way those drugs work, if you have a relapse and you start on treatment, it will take about 3 to 4 months for that drug to become effective. And over that 3 to 4 month mark, you might still have another completely new relapse because the immune system's still in the brain. And it takes about 3 to 4 months for the immune cells to get out of the brain. And no more will come in because they're being blocked. But it's not uncommon, especially for people with very aggressive disease, to have a relapse, start on treatment, have another relapse. And everyone feels very worried that the treatments are failing, but they're not failing at that point. They haven't had a chance to work yet. And so there's a 3 to 4 month window before they become effective. If you start on treatment and you have new symptoms, just hold fire, don't worry until you get to the 3 to 4 month mark.
Tell me, this is probably a basic question, but what's the difference between primary and secondary progressive?
So the question was, what's the difference between primary and secondary progressive? I don't know. No, I don't know. I don't think anyone knows. There's whether they're two different disease processes or whether progressive disease started off as relapsing, but the person didn't have relapses and just went into the progressive phase. That is still not really known. But so there's a lot of disagreement as to what the difference is. Should we care? Do we need to worry as neurologists whether someone has progressive disease, secondary progressive disease? Should patients with those diseases be treated with, if we could find a drug, will the same drug work for those two conditions? No one really knows. There is this Progressive MS Alliance, which is this worldwide group of gurus of MS neurology that have formed a group, and they're trying to answer that kind of thing. Their very first question was to define progressive MS, and that's taken them a year or something. So I think the frustrating thing about research in progressive MS is that defining the condition is difficult. Differentiating between primary and secondary is difficult, and it's no wonder we're struggling to find treatments when we can't get off sort of the ground with even answering those things. But there's truckloads of forward momentum, especially, and I imagine for people who do have progressive disease, sitting through hearing me yabber on about these treatments is probably very frustrating. But I think for me personally, it gives me great hope and also kind of relief in a way that we've found these. All of the money that used to go into relapsing remitting MS can kind of be pulled back. So when you look at what's being funded from a research point of view in MS, a lot of the money is now going into the progressive disease. So even though for individual patients who have progressive disease, there's still a dearth of treatment, I think the world has definitely moved forward to kind of get there, but it's taking a long time. Yeah.
Hearing
Yeah.
To do with the same thing. If your relapses are the same thing, just completely different places, like I had, well, it was a relapse like 10 years ago, and then the same thing happened, and it went away.
So,
And then the same thing happened about
yeah.
4 or 5 months ago.
So that's
Or does that have
when,
to be different?
so if you hear of someone who has had the same symptoms separated by time, usually a little alarm bell goes off in terms of, is it truly another event? And the reason for that is because the immune system's got the entire central nervous system to cause trouble in. And it would be a bit unusual, but it certainly does happen to cause the same symptom twice. So usually it's a completely different symptom the second time, but it can be the same. And so that's why it's important that if you have the same symptom, then you want to be very clear that the MRI scan is showing activity, because otherwise you'll end up treating disease that isn't active and potentially exposing yourself to risk. But the MRI is very helpful in that type of situation. Yeah. Oh, good.
Any other questions? Yes, hi.
At the beginning, we were talking about disease progression and accumulation of information. I wasn't really sure what you meant by accumulation of information.
So what was the other word that you said at the beginning? I was talking about
Disease progression.
disease progression.
I think it was accumulation of information.
Yeah. So disease, progressive disease or disease progression, the difficulty is that you can have the word progression in MS is thrown around quite a lot in different things, and so you have to be very clear. And I've had patients say, so and so told me I had progressive disease, or they get an MRI report that says they've got disease progression, and they feel like, well, do I have relapsing remitting MS or do I have progressive MS? Radiologists tend to use the word progression to mean more lesions, so more spots. But that doesn't mean you have progressive MS. It just means that you've had a progression of disease. So disease progression and progressive MS are two different things. Progressive disability doesn't necessarily mean secondary progressive or primary progressive. You can still have relapsing remitting disease and have disability progression. It just means you've progressed up the EDSS score. So you can see where that word just gets people into a lot of trouble. So be very, if someone says progression and you're in the room and you may be at risk of misunderstanding or understanding, just ask for clarification. Do you mean that I've got more lesions on my scan? Do you mean that I've got slightly worse from a disability? Or do you mean that I have progressive multiple sclerosis, that my disease has moved from the immune system to the loss of brain tissue, the loss of cells? So in terms of accumulation of lesions, what was your question around that?
Talking about accumulation of information.
Yeah, so inflammation is when the immune system gets into anything, it causes inflammation. So it's just like if you cut yourself, the immune system comes in to make sure no bugs get in there, it gets swollen. So that's the same thing that happens when the immune system gets into the brain and it attacks a small area of brain and causes a relapse. Sometimes you won't know that you've had a relapse because you won't manifest as a physical disability, but you will accumulate patches of inflammation within the brain tissue, and that's new lesion formation on MRI. It's a sign that the immune system's invading the brain, and that's what the treatments wipe out, hopefully. Yeah. Does that kind of make sense? Yeah, so inflammation is just the immune system being active, getting into the brain, causing problems. Yeah.
Yes, hi.
Sorry, not sure if you asked that question, but my question was about, is progressive disease due to an increase in inflammation, or is it due to the loss of more axons?
So the question is progressive disease the accumulation of inflammation or the loss of axons? So It's a very good question, and from a basic science point of view, what's always been believed is that the relapses are due to inflammation, and the progression, so that very slow loss of function and disability over many years, is due to the loss of nerves. That nerves have been damaged by inflammation or something else in primary progressive disease, that the nerves have become damaged, and so instead of being able to function, they're slowly dying. And that's what's believed to happen in progressive disease. And that's, from a pathology point of view, called a neurodegenerative process. And it's thought to be tied in with inflammation. So it's believed that the immune system damages a nerve. So it's able to function for many decades sometimes before it then stops working and dies. So the two processes are linked, but they're different. Does that make sense? So the inflammation causes relapses and new lesions on MRI scan. Progressive disease is due to loss of tissue, the dropout of cells. But what isn't really well known and teased out is whether if someone has the progressive form of the disease and is no longer having relapses and is no longer having new lesions, whether you can use the treatments we've talked about today to stop the disease. That isn't known. It's always been thought no. It's always thought there's no point in modifying the immune system, but there is potential. There's still research going on to see whether if you treat patients in this situation with Tysabri, whether you can plateau the disability. But at the moment, the current thinking is that progression is as a result of, but now no longer dependent on the immune system.
So, of all the drugs you've discussed, what treatment is available for progressive?
So at the moment, none of those are believed to impact on progressive disease. Only on the immune system causing further damage and then causing more progressive disease. But not the which is good, but not the actual progressive phase of the disease. So that's why in New Zealand we're lucky in that we don't exclude people from treatment if they have evidence of active immune-mediated disease. And that's a relapse and MRI activity as long as they can walk 500 metres. Yeah.
I'm just going to, we've got time for one more question. Is there somebody at the back? Layla.
I just wanted to ask, you said before that there's a drug trial on Celery for secondary progressive.
Yeah.
Is that happening in New Zealand?
No, I don't. I think it's in Australia though, and I think it's actually nearly reported. I think it's pretty much, they've been running it for a year or two and nearly finished. So it must be nearly out. Yeah, so maybe next time we'll know what that shows, but I haven't heard the results of it. But they did do one with fingolimod with the Galenia. They ran a trial of that in secondary progressive, and it didn't make a difference. But Tysabri is a very different drug, so I think there's a lot of optimism that it might show something, which would be helpful in terms of getting Pharmac to fund it and things like that. Yeah. Yeah, I think that in the criteria in terms of what's recommended by the NICE guidelines, which are the European guidelines for best care of patients, that patients with progressive MS should see a neurologist once a year. In New Zealand, that doesn't by no stretch of the imagination come close to happening. But I think it depends. I mean, for some people, seeing their neurologist is very beneficial and means that they get a better understanding of themselves and the world of MS and what might be on the horizon, and it's a positive experience. For other people, it's a major undertaking making it into the hospital. You get there's a grumpy neurologist, nothing happens, and you go home, and it's just not helpful. So I think it depends a little bit on what your questions are and whether you feel you would get something.
More to be on the record in case it's changed.
Yeah, I think that it's probably, at the moment, you wouldn't miss out by not seeing them, as long as you're in touch with in terms of what the trials that are coming out and what research is coming out. It's probably more likely that through the MS Society newsletters that you'll hear of those things. And as you can hear from the room, this is what we all want, and if something happens, I don't think seeing your neurologist once a year is probably going to mean that, I don't think you would miss out on something at the moment by not seeing them and being on the record. I guess the question is, and we're sort of thinking about this from the progressive MS point of view, what is it that, how can a neurologist help someone who does have progressive disease? And that we're hoping that that's a question at some point, once we jump over the hurdle of relapsing, getting people on treatment, that we can get a really good feel for.
I'm just thinking, because to me it's semi, the original diagnosis has changed, but I haven't had that unverified.
Yeah.
Would that be a good thing to do?
If you make an appointment now, you'll probably get to see your neurologist in about 2 years, so take a note of that.
Yeah, yeah, I mean, what you could do is just email the MS nurses and just let them know your situation and ask them to forward that to your neurologist and see what they think. Yeah, I would put it to them and see what they think because they know you. Yeah.
Thank you. Ladies and gentlemen, that brings us to an end here today for our wellness workshop with Jennifer Pereira. I'd like to tell you that Jennifer has been working today and then has come here to talk to you about her passion with MS. She is extremely dedicated to the cause. She has two young kiddies at home waiting
Yeah,
for her,
yeah.
and a husband. So be kind and don't hold her up too much as she's trying to leave this room. But I'd like you to show your expression of thanks because Jennifer has done this out of love and for the cause today. So thank you, Jennifer.
I'm very happy to come. Hope it was helpful.